Hi everyone, I'm Pete May, Director of Communications at Henry Ford Allegiance Health, and I'm here today with Dr. Vivek Kak, who's part of our infectious disease team at the hospital. Dr. Kak, thank you for being here with us today. There are a lot of questions around coronavirus or COVID-19, and you're our expert, so we're hoping you can help us understand this a little bit better. One thing that people are wondering is what we can be doing right now to keep ourselves healthy to prevent the spread of the disease.
So the coronavirus is what we call a respiratory tract virus, meaning that it causes infections in your nose, upper airways, as well as the lungs. So the most common way that it's going to present is with a runny nose, cough, the sniffles initially, and then maybe fevers and chills. The biggest thing that we can do to prevent is avoid people who have any of those symptoms. And to prevent other people getting sick is avoid going out if we have any of those symptoms. Try and live a healthy life. Wash your hands, wash your hands, wash your hands. And then if you have any cold or cough, use tissue, drop them off, and don't get other people sick.
Okay. Thank you. So you talked about the symptoms. What should someone do if they suspect they may have symptoms of COVID-19?
First thing, how sick do you think you are? If you just have the runny nose, stay at home. Quarantine yourself. Don't go out to the market. Don't go out for dinner at a busy restaurant. You want to stay at home. Now, if you have symptoms and you have high fevers, chills, call your family physician, kind of run through their symptoms. Don't show up at their office or the ER and say, I think I've got something that I want to be tested. Call them and then they can direct you appropriately to see whether you are sick enough that you need to be checked.
And that's really important because we are hearing misinformation out there that folks should go to the hospital or go to their doctor's office, but we want them to call first is what you're saying.
Yeah, call first. Don't call 911 right at the first go and tell them I need to go to the hospital because I think I have COVID. Do a self-symptom check, and if you aren't sure, then Henry Ford has a nurse hotline that you can call, or call your family physician.
Great, we'll provide that number at the end of this interview. We're hearing rumors about a shortage of test kits. Can you tell us if that's true, and if so, what is the potential impact on patients?
There isn't a shortage of test kits. There is an issue of how many tests can be run at the same time. So we have over 2 million kits in the country, but if all of the first 2 million people decided to rush to their ER or their physician at the first sound of sniffles, we would run out of them. So we have to test people appropriately. Doesn't mean that we aren't testing anyone, it's just that we have to test them appropriately so that we don't just kind of run out of everything within the first week.
So not everyone should expect to be tested.
Exactly.
Okay. Now we're hearing about recently imposed visitor restrictions. What can you, here at the hospital, what can you tell us about that?
So in the hospital, we are restricting anybody anybody less than 16 not to come to the hospital. I would strongly encourage everyone to stay away from the hospital and not come with a whole family crowd. Remember, the hospital is the site where our sickest patients are. We are trying to get them better. And if you have a little bit of a cold and you come in and you get them more sick, that might be what might tip them over. So it's better to stay at home. Despite what you might hear, we do our best to get our patients better. So try and stay away so that you don't bring something to our patients.
Great, and that's a nice lead-in. We're standing in front of this big yellow tent. What can you tell us about this tent? Why is it here?
So this is our triage tent. So if we think based on our screening questions that you might be somebody who has a potential of being exposed to COVID-19, you're going to come here, we will triage you, we'll test you here, and depending on what we find, we decide where you go into the hospital. The hospital is ready for patients, and but we want to be sure that we treat you appropriately so that we don't expose more people to the potential infection, especially if you sit in the ER with a runny nose and you have a potential COVID. We don't want you to infect other people.
Great, thank you. Well, you've answered a lot of our questions. We know there are many more questions that people have, and we'll do our best to answer those in the coming days and weeks. We're going to be doing this regularly.
Hopefully.
So we'll do some more videos. In the meantime, we do want to make sure people know about a very important resource on the Henry Ford website. It's a coronavirus or COVID-19 page. You visit there by going to henryford.com/coronavirus. You can also go to the CDC website at cdc.gov/coronavirus. Dr. Kak, you mentioned a hotline, which is set up through Henry Ford Health System. So if you've recently traveled to one of the 5 indicated countries, which are China, Iran, Italy, Japan, or South Korea in the past 14 days, or you've been exposed to someone who has, or you're showing symptoms that Dr. Kak described, that hotline phone number is 313-874-7500. Thank you for listening.